Hello, everyone, and welcome to this very special CMEpalooza Spotlight. My name is Scott Kober. I am one of the co-producers of CMEpalooza, and I'm happy to be joined today by the grant team from Daiichi Sankyo. And we are going to be talking about the topic of innovations in continuing education, a supporter's perspective on using RFPs to enhance public health. There are three ways to ask questions during this session. You can use the CMEpalooza text line to send in a question. The number is 267-666-0CME0263. You can tweet your question to us using the CMEpalooza hashtag. And one new thing that we are doing for this session, if you are watching this on our live page, which I assume most of you are, and if you click in the lower left-hand corner, there's a button that says Watch on YouTube, and you can open up this broadcast in YouTube, and then you can enter in questions within the YouTube chat function. So we're going to see how that works as well. We will get to as many questions as we can during this session. So we are going to be using Poll Everywhere interactive audience response technology during this session, during the introduction, so here in a couple minutes. So for people watching, if you don't have the Poll Everywhere app, you can quickly download it and join the presentation entitled CMEpalooza 005, or you can type in the following URL in your web browser, and I won't read off to you. We will be showing that kind of the banner on the bottom of the screen here in a moment. So let me introduce our panel for today. So we have three members of the grant team from Daiichi Sankyo. We have John Ruggiero. John is the functional head in medical affairs. We have Antonio Mayo, the associate director in the Office of Grants and Education. And we have Terry Bechet, who is also an associate director in the Office of Grants and Education. So thank you so much to the three of you for joining me today. All right, as we begin, as I said, we're going to be using Poll Everywhere. So for those of you who have the app on your phone or have gone to the URL below, here is our first question. This is geared primarily towards supporters, so we're hoping that supporters will answer this question. Does your organization issue requests for proposal, calls for grant to support your educational strategy? Yes, regularly. Yes, but only when specific and timely gaps arrive. No, and we're not planning on doing this in the near future. And no, but we are considering doing this in the near future. So I will leave this open for a little while so people can respond. And as responses are coming in, maybe John or Terry and Antonio maybe can briefly kind of talk about Daiichi's kind of perspective towards this.
Yeah, and Scott, thanks so much for actually inviting us to be part of this session. That's number one. But secondly, it's really interesting to see the breakdown of the responses that are coming forward. There's a diversified approach and perhaps a diversified way of thinking around what RFPs are beneficial for, and also the challenges with the RFP process in general, not just to the supporter, but to the provider community as well. I hope that in this session, we're going to recognize both and give some perspectives that might be helpful for those of you that are thinking about how you're responding to this question.
Great. All right, so here's our second question. This question is for providers. Do you respond to RFPs and calls for grants that are issued by supporters? Yes, it is a core part of our grant strategy. Yes, but we are selective in those that we respond to. No, the time and resources necessary to develop a proposal outweigh our chances of success. And no, but we are considering doing so in the near future.
Might be interesting to see if Terry or Antonio, if either of you have any quick items to discuss regarding this question.
From our various conversations with providers, it does seem to be a bit mixed. I think as more supporters are issuing RFPs, I think by natural cadence, more people will need to be responding.
Yeah. One of the insights that I have related to this question is that I absolutely respect, agree with, and understand why people would select C. Sometimes RFPs are not the appropriate way to move forward. Again, something that maybe we'll address today. But there's also usefulness to the RFP process as well. And so it's just really interesting to see these different perspectives come through. Terry, did you have anything you wanted to add?
It's interesting to see that there's 20% of providers that, feel that it's, the time and resource that it takes would, it's too much. I'd like to hear a little bit more about that at maybe another session.
Okay, great. All right, here's our next question. For supporter to utilize RFPs, okay, so this is a subset of the people from question 1. Are outcomes that are yielded from the RFP process more aligned and or relevant to your organization's medical strategy than outcomes from other activities? Here are your choices. Yes, the outcomes shared as a result of the RFP are always more aligned with our educational strategy. The outcomes shared are similar to those that result from the unsolicited grant submissions. No, outcomes yielded from the RFP process are usually less informative and relevant, and unsure, but I would like to find out more.
I think the only comment that I would have here is that we're going to actually get to this on what our perspective on this is. No surprises whatsoever in the responses that have been generated or are generating right now to this question. Would be shocked if somebody responded to option C, and watch, somebody will respond to that now that I said that. But even if that's the case, there's probably reality there and reason for it, and something that we would discuss in the future.
Okay, great. So there's 2 more questions. So this is our second to last one. For everyone, would utilizing concept submissions be helpful prior to submitting or receiving a full grant? And by concept submissions, I believe what we're talking about is kind of a quick 1 to 2 page kind of summary of what you would foresee including in a full grant summary. So yes, this may be helpful for both presenters and supporters. No, I feel like I need to provide or review a full proposal to understand all the components of the submission, or unsure, but I would like to find out more.
Again, no surprises. I think that there would be reasons why I might vote for either of those options that are on this slide. Terry and Antonio, you can add in there too, but this is something that we will discuss.
Yeah, I think just from my perspective, I think having a concept is really helpful because I think it alerts providers, if we're really interested, to move forward with seeing the full proposal rather than spending all the time and resources to put a full proposal when in the end we would not be interested in moving forward. So I think it does help them with time and resource allocation.
Yeah, especially related to the way that that one question was responded to, right? Where
exactly.
There was a percentage of, I think maybe 20% of providers that felt like it may not be worthy of the time to put into the response of an RFP. But yeah, we will get to this.
Okay, so we have one final question. This is probably the most important one. This is for everyone. What is the correct spelling of this wonderful event? And you can read your choices here. And I know this is always one of Derek's pet peeves. So we will see if people know how to spell CMEpalooza.
We should note Scott is tracking your responses for this question.
People are probably quickly going to the website to look it up. All right, and there actually is a correct answer to this one. It is E. No, I'm just kidding. The correct answer to this is C, CMEpalooza. Derek has said anyone who gets this question wrong is banned from attending future CMEpalooza.
Not true.
So please put a mental check mark in your calendar. Okay, so that's the end of our audience response question. So now we're going to get into a discussion of this specific topic. And I know that we've got some slides to support some of the things that John and the rest of the team are going to talk about. But I'm going to be kind of moderating kind of this conversation and hopefully getting into some of the issues. And as I said before, if people have questions, certainly feel free to send them our way. So my first question, is to you, John. So from the supporter perspective, what is the presumed value of the RFP as part of an overall grant strategy?
It's an excellent question, Scott. Yes, we were prepared to answer this, so thank you for prepping us with the questions you were thinking about. I hope that what I'm about to speak to gets to that point. You'll interrupt me if you need more information. But first and foremost, again, I wanted to thank you for the opportunity for having us join you for this discussion. We were really proud and regularly proud to support CMEpalooza throughout the years, regardless of how it's spelled, right? Because it's always promoting really great content for discussion. And I also guarantee you that we have seen some really interesting spellings for Daiichi Sankyo as well. So we totally understand the frustrations that you or Derek might feel. I'm really happy to be joined today by Terry and Antonio, who I consider not only incredible partners, but incredibly smarter than I am on several different issues and contexts of business. And I think that for most of what you'll hear today, it will be from them. So I'm going to just keep this brief, just by a couple of minutes. So just addressing your question and grounding us in what you'll hear today. I seriously mean this. We have built a culture at Daiichi Sankyo that helps us to believe and practice that it is an honor to be considered supporters of the independent educational programs that you submit to us. Even if we can't support them from time to time, just being asked is an honor, because your activities are creating value for better patient care. Now, we value unsolicited grants as much as we value responses to requests for proposals. You need to hear that. We support both, and we're going to continue to support both. This is going back to some of the polling questions that you just had. There are reasons why we as a supporter embrace the ability to issue RFPs. They are our opportunity to transmit our understanding of the gaps and needs to the provider community, who have an equal opportunity to provide a solution that we do not have. Equal because you're all responding at the same time that something is being issued. They are sometimes helpful when budget cycles call for specific spend in specific quarters, and when public but unknown data has emerged, and when critical references need to be explored more. It's also helpful for us to identify comparative provider skills, just to be completely transparent with you, and the capabilities that those providers have during a specific RFP cycle. And why this is important: sometimes we're not going to be able to approve an RFP because of the amount that we receive, but understanding more about your capabilities, what you submitted as an idea, and what you are able to do might generate thoughts for approving future grants of yours that are either responding to future RFPs or unsolicited. So it is a very thorough process for us, and we consider all aspects of it. As I think you're going to see, if used appropriately, meaning that we're less directive on what the solution is, that we believe is the educational provider's expertise, not ours, but more providing an edict of scientific gaps and themes that need to be explored, an RFP becomes a blueprint for creativity and a map for all the useful outcomes necessary to show that education made progress over a specific benchmark. That is a key component with RFPs. If there are benchmarks that we need to overcome, RFPs might be able to help us show that in a narrative. It's also a great way to gain multiple internal stakeholder buy-in and attention, as there's usually an intense amount of collaboration across our organization when an RFP is introduced. And therefore, the organization's really eager to see the follow-through of that RFP. Now, you may have all heard us speak about the educational cycle, whether evidence sits in a bucket as newly emerging, existing, or established. And depending on where the evidence lies, there are different strategies that a supporter and provider might consider as being most effective. This could be a vital reason why it may make sense to have RFPs in some areas over others. But this is our experience so far. This is my last comment I leave you with before transitioning to either our next question or to our next panelist. We usually have received approximately approximately 50 phase 1 executive summary concepts on average for each RFP that we've issued. So we do it in 2 phases. We welcome executive summaries first to save you the time of submitting a full proposal, which we know is timely and costly, only to feel like you'll be rejected because of 50 submissions. While challenging to do so, because providers make the concepts so appealing, we usually then invite an average of 5 to move forward to a full grant submission. But we're not bound by that number. So sometimes it might be more, sometimes it's less. And that first phase selection happens for certain reasons, be it the design and technique that's being submitted, the history of the provider's ability to attract learners and generate detailed outcomes, the collaborations that may be part of the plan, being maybe the appropriate and right collaborations to help the learning audience get the information that they need. And it could be even the fact that the provider goes beyond the RFP, it takes it to the next level and starts using the gaps we identified and then finding what those national or regional benchmarks are and showing how they're going to overcome those. And then we'll select from those 5. So I think that we're planning to discuss a case study today that will hopefully be helpful as an example for you. And you'll hear more about the value of the RFP process, as well as the challenges that we recognize need to be addressed. And we'll close the session today helping you understand our direction in moving forward with an equally weighted RFP process along with the acceptance of unsolicited grants. But as you listen today, just remember the following. We're one specific company. We will do our best to represent a general supporter's perspective. Trust that each supporter has a different role to play. They have different strategies. They operate under different issues. So our perspective on this will try to be general, but we don't mean to suggest that we represent all supporters. And we have collected some trending statistics that actually indicate that compliantly defining parameters through an RFP has actually enhanced engagement across our organization. It's allowed for creativity on the provider side, actually helped us diversify our supported provider pool, as it just so happens that each RFP we've issued has welcomed awards from various providers, not always the same ones. So just keep that in mind as you hear some of the next few responses to Scott's questions. Scott, I'm going back to you, and I'll address anything you might have, or we can move on.
Okay. Yeah. Great. No, I think the transparency here is really interesting. I think a lot of providers who submit RFPs are, don't always know how many people are kind of going after these and how challenging it can be.
Right.
So I appreciate you kind of sharing that data with our team. So yeah, no, I think let's sort of move into kind of talking a little bit about this specific initiative. Because I think that's probably gonna be the most interesting thing to kind of go through. So Antonio, let me kind of turn it over to you, and maybe you can talk a little about how Daiichi took the opportunity of the COVID pandemic to rethink the way in which the grant department there develops its annual educational plan.
Great. So thank you for the question. I think specific to this RFP that we issued, there were some processes, things that were different, and then a main difference in the ideation and where it kind of stemmed from. So first and foremost, the timing and the execution of the RFP were both accelerated from a more traditional planning process where it takes us several weeks. We're doing analyses of needs assessment, landscape analysis, working with our medical affairs team to get some information. This was done a lot quicker. We also drastically shortened the timeline for submission, review, communication of approvals, and additionally in the RFP, the anticipated launch date that we were hoping for providers to be able to reach was much quicker. As you can see on the slide, we did this from issuing the RFP to approvals within a month. It was, I think, about 20 days to 28 days for notification of the approvals to be submitted. Additionally, from the polling question and what John had said, we due to the timing of wanting to get this education out quickly, we did not initiate a phase 1, and we did not seek executive summaries for this RFP process, which we have been doing traditionally with our more often with our traditional RFPs. So for processes, that's pretty much the main differences. For ideation, I'm sure with a lot of supporters and providers, there were ongoing discussions around COVID and the impact that it would have on our patients and what our role within medical affairs might be to fill some of these voids and question marks during this time. Our field medical affairs team actually brought this very specific need to us directly. They came to us and shared the conversations they were having with their HCPs in the field, who were expressing concerns around not what COVID is necessarily, but the continuity of cancer care during this time. So working closely with our field medical colleagues, we then saw additional information from our larger medical affairs team to see how this education might fit into whatever plans they were working on and the education that they were trying to develop internally as well. So again, what makes this initiative different from a more traditional RFPs was this need, again, was brought forward by a specific group. Our field medical team came to us and specifically said, we want to work with you on finding a way how to reach our HCPs in the appropriate way and provide this information. Whereas in a traditional RFP, our team is looking again at the needs assessment, outcome reports from prior supported programs, doing landscape analysis, doing our own white paper research to figure out needs and then where those gaps are and how they can be addressed with certain objectives. And then we bring that forth to our larger medical affairs organization, making sure it's aligning with their goals and their objectives, gaining their support and alignment as our budget does come from medical affairs, making sure that we have their support when issuing these requests for proposals.
Okay, so I assume that this happened April, May, somewhere in that time frame of 2020. So then kind of walk us through then what happened after the RFP was sent out to providers. Kind of what did the process look like from the time of receiving the submissions, reviewing approval, and then kind of the initial rollout phases?
Sure. So as I said, we didn't have the executive summary phase or phase 1. So we did receive full grant proposals. After the team evaluated all of the proposals received together, we did make recommendations on several, and we brought forth to the entire medical affairs organization to get their input and insights into this. As information was developing, we wanted to make sure we stayed on track with the need that we've identified of this, specifically within COVID, and bring them aboard with us through this process. So we actually had them, we explained to them the educational interventions and the formats that the providers were proposing within these grant submissions, and work with them to really identify the ultimate goals of what the RFP was sought out originally and the need that field medical brought to us to make sure we were still aligned with that. So as we were approving these, we were really looking at not just the objectives and the educational intervention of these proposals, but really continuing to think about the science of learning. We wanted to keep in mind the plan, do, study, act, outcomes process, giving the providers the opportunity to continue to develop this as the information continued to develop around COVID as well. There are so many moving targets, things changing daily, weekly. We wanted the providers to be able to adapt to that as well and continue to meet the needs of the learners with the programs that they were ultimately conducting. So as we envisioned through the RFP, we were looking to support an entire educational continuum and curriculum to fill this need for the learner over a longer period of time. As we see, we're still in it. We weren't sure how long this was going to last. We're on more stable footing now, but being able to provide information, not just through one program on a set date, but over a longer period of time. So we felt that the activities that our group and with medical affairs ultimately approved really fit those needs and identified based on the primary objectives that the RFP were seeking out. So again, looking at cancer diagnosis continuity of cancer care of patients who are already diagnosed and in process of receiving care, safe and effective AE management, and clinical trial continuity, keeping people involved, committed to the process, to the trial, communications with their investigators. So as we were reviewing the grant proposal, we're able to ascertain this natural cadence from certain providers that met the goals and objectives that we were seeking through the RFP.
Antonio, I don't mean to interrupt you, but there actually, I think you have a visual that might help you with what you're just describing.
Yes, thank you, John. Scott,
maybe the next one. Yeah,
I appreciate it. So the proposals, as I said, that we ultimately awarded for these RFP submissions really followed this kind of cadence set out here with some overlap. So again, getting back to understanding how people learn, we didn't want just one program that talked about something specific and then the one away. So there was some overlap between the programs that the providers were proposing to be conducted. And through that, the learner was able to receive information several times and over a longer time period of information. I think most programs ran through the autumn and continued with on-demand access after that. So by sharing the names of, we then, after awarding, we did share the names of the providers and the proposed topics of support in hopes that these providers would then see that natural cadence as well of the grants that we were supporting, and work on ways to, on the back end of things, work together to continue that flow and that continuum of education on their own at that point.
Okay. One question that came in, this will be a quick question, then we'll kind of, I'll ask you a little bit more about this topic. So how did the volume of proposals for the COVID RFP compare to the volume that you get for a typical RFP there at Daiichi?
Antonio, maybe Terry and I can take this only because I know you hadn't been with us at that time. Terry, wasn't it around, instead of 50, we received around 30?
Yeah,
if I'm correct?
30. Mm-hmm.
Yeah.
Okay. So then, Antonio, what was sort of the feedback from the four providers who were awarded the grant when you sort of explained that the process was going to be a little different for this RFP than a typical RFP where you simply say, you know, yours is approved, go off and do your thing in your own silo?
Yeah, I think it was well received. I think everyone appreciated the openness, not just those who won the awards, but those who did not win the award as well, knowing that the process was kind of naturally closed out. There were 4 providers who received that the award itself, and just staying as open and compliant as possible with all of the providers in case this education around COVID needed to continue. Making it very clear that these awards were being issued. However, the opportunity could still be there in the future, depending on needs around COVID itself. So at that point, while we wished for this process to remain independent and compliant, not just wished, it needs to be independent and compliant, but after we shared the award, who won the award and the proposed topics of those grant proposals, we didn't actually go back and solicit information confirming whether the providers were communicating with each other on the back end. At that point, we really only served as the conduit, in which we typically do in a more traditional supporter sense. We waited for program updates, faculty information, scheduling of the program itself, registration links. We received the information post-activity launch. Providers stayed very much in touch with us, giving us updates regularly, as this was a very interesting topic internally to see how our reach and how this need was being addressed. And then collecting and aggregating the outcomes data themselves. We did all of that on the back end. So while we are unaware if the providers ultimately communicated amongst themselves, because we didn't specifically ask for these updates, as Terry will be able to share, we're confident that the educational impact that we had hoped for was achieved based on some of the outcomes that were shared with us.
Antonio, let me interrupt you for just 1 second. Terry, did you have anything you wanted to add?
Oh, no.
Okay, because the one thing that I wanted to say, Scott, the question you asked is a really important one. It could be addressed two different ways. One way, the way that Antonio just addressed it, which is absolutely on target and probably was aligned to whoever asked the question. Another way I could answer is how did people respond to the rapid pace of the release of the RFP, and how did they react to being pressured to respond quickly and then launch something quickly? I think some responded really well to it because they were already preparing for how to contribute to the pandemic, and were able to commit to having something put into place pretty quickly. Others weren't as prepared. That's not a slight on them at all. It's just that wasn't within their domain, their purview. Those people, those providers just decided this wasn't the appropriate RFP to respond to, and that's okay. So another reason why in the polling questions, I don't think it's a bad thing if providers decide that they're not going to always be as responsive to RFPs. That's a choice that is absolutely respected.
Yeah, and I think certainly being mindful that when this rapid response RFP came out, a lot of providers were going through upheaval of their own and trying to think about kind of what their world was going to look like. So keeping several balls in the air isn't always the easiest thing. Okay, great. All right, so Terry, I'm going to kind of now ask you a few questions about some of the outcomes from this initiative, and I know that you guys have some data on a couple slides here. So what was the meaningful data that came out of this from your team's perspective?
Yeah, so thank you, Scott, for the question. And so the awarded winners are there on the left, and from all the 4 programs, you can see that there were over 10,500 learners. And one of the things that we had requested in the RFP is really that it would focus on oncology, the oncology healthcare team. And you can see that 83% were oncology HCP. So that was a real kudos to all of the providers that were able to attract target such a large audience in such a short period of time. And over to the right, you can see that in addition to such an outstanding reach, there was also great increases in knowledge around the 4 domains or gaps that Antonio identified, along with increases in confidence and a 59% commitment to change practice. So we were really impressed to see that. And if you actually move to the next slide, Scott, I could highlight some of the major takeaways from the programs. So research to practice, what they did, they actually conducted a patterns of care survey, which was really the foundation of their project or their program that went out to 75 community oncologists. And what they really tried to decipher is, how did cancer care change during the pandemic? Were treatments adjusted, delayed, or discontinued in order to really optimize cancer care during a time of social distancing and during a time of quarantine and during a time of telehealth, where they weren't able to see their patients as often? So we see that with this program, there was such great knowledge gains. Clinical care options continued on the theme of cancer care continuity, but they specified their 2-part program around breast cancer care, specifically from early stage all the way to late stage, including metastatic. And we see that there was an increase in confidence associated with how to care for these breast cancer patients along the cancer care continuum. And there was also, they also coupled their education with, how do we decipher the respiratory symptoms that are commonly seen with cancer therapy versus cancer progression, and also with the COVID symptoms, the respiratory symptoms that we commonly saw with COVID. So we saw that there was a 52% increase in confidence on the clinician or the learner's ability to decipher between those types of respiratory symptoms. And then on the next slide, there's a couple of highlights with the last 2 providers. So Medscape, they also continued on the theme of safe and effective AE management during a time of social distancing. And what they really focused in on was telehealth. How can the cancer team work collaboratively to really assess a patient, both efficaciously to make sure that they're actually doing well on therapy, but also to assess them for AEs. So telehealth was kind of new. It wasn't something that was commonly used prior to the pandemic. So they needed to use this medium to actually make sure that patients were effectively being treated and also effectively assessed for adverse events. And if patients necessitated coming in for a live visit, they needed to work together as a care team to make sure they brought that patient in. And PER, what they did, or what was unique about their programming, was that they did weekly webinars. And what I really liked about the weekly webinars was that every week they would focus on a different cancer topic. And it was nice because they've recruited faculty from all around the country. So every clinician or every faculty member from around the country was talking about what was going on with COVID, and specifically, how did that impact their cancer patients during that time. So it was a really nice sharing of best practices. So if New York City hit its peak, when New York City hit its peak, they talked about like what they were doing to care for cancer patients. For instance, how do we continue life-saving trials during this time of social distancing, and also when everybody was in quarantine? How do we continue those life-saving trials, and a sharing of best practices from all around the country? So I really thought that was nice, and they rounded out their program by also talking about cancer care continuity. So I would say they were like some of the major outcomes or takeaways from this case example. But if I could just take a step back and just talk about like outcomes in general from the RFP, I really felt that the RFP process, while it's really hard to associate it since it's only been a year since we've been issuing RFPs, that really the types of outcomes, I know we asked a question about it in the beginning of the presentation, we feel that the outcomes to date have been more aligned and more strategically aligned to, somewhat to, I guess, the strategic imperatives from an organizational standpoint. Because as John alluded to earlier, we're providing the providers with somewhat of a blueprint, not only of the educational gaps that exist, but the outcomes that we're seeking. So I think, we were able to really see some great outcomes. So, a great thanks to all the providers that were able to work quickly and provide us with this during an unprecedented time.
Terry, can I add to that too? Because I think you're right on target with this. And I think that the example that we're showing today demonstrates another useful reason for an RFP, right? I mean, we have no control or influence over an educational program that is independent from that influence, and we stand by that, and we take it very seriously. But the fact that we were able to issue an RFP and then transparently provide the community with our decisions and welcome people through that transparency to feel as if they wanted to work together, that would be totally fine. So that there was seamlessness and continuity and not overlap and not competition with each other's programs. Again, to Antonio's point, he's right. We didn't direct that, nor did we try to follow up to see if they were doing that. It just so happens that things were launching pretty consistently with one another in a curriculum style. And so again, we give great credit to the educational providers who are doing all this fantastic work and trying to make a difference in the populations. And at the same time, would that have been able to have been accomplished if an RFP didn't exist? Right, so that's another reason to demonstrate why RFPs could be very useful in addition to the detailed outcomes that Terry just described.
Also,
go ahead, Antonio.
That point, John and Terry, it also helped internally too. So as our teams are trying to figure out what's our place in educating and reaching out to HCPs and caring for the patient population that we look to focus on, whereas we did get very generalized COVID unsolicited grant requests. What is COVID? How do we manage it? Daiichi's focus is cancer patients, metastatic cancer patients specifically. So what is our role in seeing the outcomes that have been shared with us and being able to share that internally, that we were still contributing to the education that was needed on a global scale of what COVID is, but more specifically, the outcomes are relatable to our teams and our mission at Daiichi and what we were trying to accomplish.
Right, the RFP helps narrow the guessing game gap,
Right.
that a provider has to go through. And I understand it's more than a guessing game. I know that providers have an incredible team of medical personnel who are always following data and analyzing it. I came from the provider side over 12 years ago now. It's making me feel really old at the moment. But and so I get the amount of work that goes into the analysis of a submission in the first place. But there is a lot of sometimes guessing and trying to align what you think is going to be strategically important to the supporter you're submitting to. And so an RFP helps narrow that, to Antonio's point.
Yeah, and case in point, we always share the outcomes that were provided with our medical teams. And when we shared outcomes recently from RFPs that had launched, previously, not the COVID example, but a different example, the medical franchise lead actually said, these are great outcomes. Like, we can really see, the gains that took place and also the gaps that still exist. So I think it does really provide a true value to the organization as well, and to elevating patient outcomes, so we can still continue educating or supporting education where there are true gaps.
All right, great. Well, I think we were going to try to have this about 40 minutes, so we're right about the 40-minute mark right now. So I think that there's been some really great insights from your team, and kind of always pulling the curtain back on the RFP process is always great for providers to kind of see, how exactly things kind of roll out internally on the supporter side. So I want to thank you, John. Thank you, Antonio. Thank you, Terry, for joining us today. And for all of our loyal viewers, thank you for tuning in. Just a reminder, CMEpalooza Fall, Wednesday, October 13th. The agenda is coming soon. When I used to ask my mother growing up, when is dinner going to be ready? The answer was always soon.
Sure.
What did that mean? It could mean just about anything. But we are working on it. So we hope to have it for you here in the next couple weeks.
Scott, may I make just one closing remark, just in case people have questions from this, because I want to reemphasize this. We will still be welcoming unsolicited grants. We value those as well. And if at all I can provide some kind of idea of a percentage, while not perfect, I would assume we will always have at least 50% reserved funds for unsolicited grants. And there are reasons for that. We don't have all of the answers. You sometimes do. Okay. And so I just want you to hear a commitment from us, at least. We will do everything possible to communicate early, meaning in the last quarter of our fiscal year, at least, to provide direction on what our RFP versus our non-RFP plan will be for the year, so that providers don't have to do a lot of heavy work before that is communicated. At least everyone will have the idea and the blueprint on a yearly basis. That is what we will try to commit to everyone.
Great. All right. Well, thank you once again to John and Antonio and to Terry, and we will see everyone soon.
Thank you so much.
Thank you.